in the room. I thank you all for coming. Happy New Year for anyone I haven't shared that with as yet. And call this meeting to order and remind that the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and the media may also be audibly or visually recording this meeting. So, and another reminder that you are to turn your electronic devices on non-audible function during our committee meeting. Madam Clerk, are there any changes to the agenda, please?
There are no changes to the agenda.
That is perfect. So, can I have a motion to approve the agenda about to be amended? Councillor Partis, before we do that?
Yes, thank you, Mr. Mayor. And I just, a question on process, please, if I may. I'm just wondering why 11.1 isn't under consent items. Just a question on that process.
It's general practice to put correspondence items under general information, as we have in the past with the Board of Health.
For Board of Health?
Yes.
Okay, that's fine. Thank you.
Okay. Alrighty, so I have a motion to approve the agenda, moved by Councillor Johnson, second by Councillor Connolly. All in favor?
Carried.
Carried. Thank you. A motion to approve the minutes of December the 5th, 2016, moved by Partridge, seconded by Farr. All in favor?
Carried.
Carried. And I'm going to invite, and I do see Dr. Elizabeth there, is going to speak to the issue of Public Health Services 2017 Departmental Operation Work Plan. Dr. Elizabeth. Good of you to do.
All right. So you'll recall as we went through the...
You can grab that microphone and aim it towards
closer.
you and maybe speak to it. Thank you.
You'll recall, oh, that's right, you moved it down here, that's right. So you recall as we went through the Board of Health review that we did earlier this year and the comments that came back, there's some discussion about the department operational work plan and wanting to have a more explicit discussion about what the plan is and wanting to have follow-up at least twice a year to talk about what had been accomplished, where were we going, that sort of thing. The Department Operational Work Plan, we use a format generally that is set out by the City Manager's Office in terms of form and function, so I'm not going to go into a lot of detail in terms of what we might find there, but I'm going to concentrate on what are the particular priorities in terms of the upcoming year. So that's where we're coming from with this piece. You did have the year in review at the December Board of Health meeting, and this one's going to talk about 2017 and moving forward. So our work, of course, is meant to fit in with the City of Hamilton's vision. So you know, of course, our vision to be the best place to raise a child and age successfully and to provide high-quality, cost-conscious public services that contribute to a healthy, safe, and prosperous community in a sustainable manner is our mission. And so it's very important for us to start with these and the City's priorities that are expressed in the people and performance plans and the strategic plan, and to look at how we can move forward in terms of advancing those. There are a lot of pressures going on, and quite frankly right now it's a bit of a frustrating piece. I was just meeting with Councillor Collins earlier this morning and talking about some of the don't knows that are out there in terms of PHS, and there were some things that we thought would be resolved by the end of December, i.e. new Ontario Public Health Standards for public health, which of course drive about 98% of our business. And unfortunately, those have not been released as of yet. And from a timeline perspective, all we know is that they should be coming out soon and coming for consultation. But the soon has happened a few too many times, and I'm now no longer guessing as to when that might be. I don't have an educated guess at this point as exactly when. We know we're also working within our provincial and municipal budget challenges, and so we know those are key. And so, of course, we have the discussions that are happening within the city about how to meet those. And provincially, I can tell you that similar discussions are happening at that level. And indeed, when we hear about the OPHS and OPHOS review, what we tend to hear is they're going to be asking us to do more with at least the same resources. And so from the standpoint of scope and those sorts of things, we're not expected to get, any less in order to, that needs to be done, and we're not expected to get any more money to do it. The health system transformation agenda, of course, is a huge piece for everybody who works in health and for whom their lives are touched by the health piece. And so that's sort of formally expressed through Patients First and the changes they are making at a LHIN level, the changes they're making to the CCACs, changes they're making in terms of public health relationship to the CCACs. But it's happening on a broader level as well, just as we look at how do we deliver the right care to the right people at the right time, right place, all of those things. And so everybody within the system is trying to look at new ways to better serve our citizens or patients, depending on what your framing is, at a lower cost. And so there's so many initiatives that are coming at us, requests and things that we have. And I'm going to go through some of those ones as we go through the details. And then, of course, we just have the bottom line, which is that we actually want to improve people's experience and responding to our own community's needs and expectations, a lot of which were expressed through the plan. But of course, as we listen to our community, we do community engagement, we hear new and more specific details as we move forward. So ultimately, where do we want to be? And this is one of those pieces where I think really understanding public health's role vis-a-vis the health care system's role is really important. So we want to have an engaged and effective workforce with the competencies or the ability needed to increase health and health literacy, to decrease risk behaviors, and help the population develop the capacity and skills for health. And that we work within a larger health system, a larger health and social service system with a focus, for us in particular, on the population's health as opposed to individual health, and programs and services where we have the necessary skill set. So this really comes down to, and the best organization to deliver. We're not in the business of duplicating for the sake of providing something that might be out there, whether it's in the mandatory programs, the OPHS or not. So the example here is the flu clinics as an example. As the province made changes, pharmacies came on board, we were no longer the best game in town in terms of making sure everybody had access to the flu vaccine. They could either get it through their primary care provider, or they could really get it through those pharmacies, many of which are open till midnight or other hours, and could be accessed at a time of choosing. You usually didn't have to line up or make an appointment, and so they were far more accessible. But in the area where we had the expertise and the role, which was immunizing kids in schools, that's where we needed to put our focus so that we could increase our reach to those who are the most vulnerable in accessing those vaccines. And so that's the kind of trade-offs that we're talking about when we go through and do our work. You've also seen this diagram a couple of times, and it continues to be a really important one in terms of where we're saying we should spend our efforts. And I know sometimes this is a little bit challenging. So at the top of this pyramid are the programs and services that are individually focused, but they take a lot of manpower, a lot of resources in order to make any difference. At the bottom of the pyramid are the more policy level changes, the systems level changes that require less manpower in order to have a broader impact on more people. So this is based on some work by Frieden. It's a well-accepted framework. It's been used in the US and Canada and elsewhere. And it really talks about how those counseling and education sessions, so sitting down with a person and having nutrition counseling, those sorts of things really have a small impact on just the people who are sitting right in front of you. Whereas when you're working further down the pyramid, you can have a much broader impact on many people with those same resources. So let's take that a little bit further. So you've got, for example, one of our PHNs doing counseling with 7 students in high school, or on 7 people around particular issues that they may be facing. You can impact those 10 people in that 7 hours in one day. If that PHN is instead working with a community group to bring about a new policy that is going to apply across the board, and here the example that was used was living wage, you can actually impact so many more people's lives in a more fundamental way through the course of that work. You think about it as well when you have, for example, dental services. So if we had preventive services being offered for 15 clients in a day, that's how many a hygienist might see. But on the other hand, if we had somebody working on advocacy around community water fluoridation, now we're a fluoridated community, but maintaining that, monitoring it, you can have impact on the entire population in terms of improving their oral health. So not to say that there's not a need for the individual level services. It's just when you look at public health's role, our role has moved more and more away from providing the individual level of service and to looking at those broader interventions that can bring about change on a systems level. So when you look at our priorities in 2016, these were the ultimately 7 areas that we spent most of our time as a senior management group and invested heavily because these are areas that were undergoing change and needed some of our focused resources. So health systems integration, poverty reduction, PHS workplace culture, so we have a workplace that supports the work, Healthy Kids Community Challenge, the food strategy, healthy birth weight strategy, and privacy and records and information management. So you've seen pretty much presentations on every single one of these in the past year, a reference made to them, and so these are the important issues we'd bring back to the board and report back on as well. For 2017, we stepped back and said, okay, when we look at what's going on out there, really our priorities don't change that much. If anything, they become more and more focused and refined. But the number of initiatives going on under any of those priorities has become more and more numerous. And so health system integration is an absolutely key one for us through 2017. So looking at how do we engage with community partners to improve population health outcomes and address health inequities is what this is focused on. And there are a number of different initiatives that we're working on that relate to that. Most of them, again, are looking at that lower parts of the pyramid in terms of intervention, in terms of our role, but are often connected to service delivery by others in terms of influencing what they do and how they're effective. So we have the Mayor's Health Table on refugees, which Dr. Emily co-chairs with one of the primary care individuals, and looking at how can we improve health for our newcomers to the community. We are exploring with the other health services leaders in the community whether there is a different model in which we can all organize and align our resources to better serve people in the community. That's the accountable care organization model. And so there's an initiative underway to look at that. How might we best align with that? And you can expect a presentation on that coming up probably by March or April. The next piece is food strategy. So we've moved from ideas to implementation around food strategy. So there'll be some reports coming forward around that and moving specific elements of it forward. Healthy birth weights strategy, youth sexual health strategy is another piece. You heard the presentation from this group at the end of last year around the good work that has been done to reorient services to meet teen, youth, moms, families' needs, and better align all of the health system to serve those groups. And so we're expanding that to look at youth sexual health as well. Physician engagement is a key piece in this in terms of alignment. We're doing some work with Dundas and probably will expand that up to 2 other communities. It's just being discussed in terms of working with the family health team about how do we understand that community's needs. So in this case, the family health team came to us and said, how can you help us understand what we should do here? And so Julie and others have been working with the group to really understand how to do community engagement well, to understand what the community wants, where the community wants to go, what are its priorities, and then look at how can their resources be aligned around those needs to meet the needs of that community. And it does really come down in part to that piece about, as professionals, we often have an idea of what we think needs to be done, but what the community really wants and what they're willing to engage with are oftentimes different. And so we can spend a lot of time knocking on doors as professionals that ultimately, if we don't have that community input about where they're willing to move and go, that's not effort well spent. So there's been a lot of time spent on that, or a fair amount of time the past year, and it'll be a focus going forward. Speaking of what we base our planning on, we're doing a lot of work with the LHIN on data and making sure that we have a comprehensive view of the health status of this community and doing similarly across the other communities that are part of our LHIN. We're working with our health promotion specialists to expand their competency to do the sorts of lower part of the pyramid work, looking at evidence-informed decision-making. How can we get better at making sure science is used in our decisions and in the information we bring forward to the board, get better and better at that. And we've similarly got other pieces to support those. So as I said, it seems like one priority, but there's a lot of work going on underneath that priority. Poverty reduction will continue to be a key area of focus for us. So we had, of course, municipal motion for the $50 million investment into strategies to reduce poverty around housing and supportive areas. That's going to be coming back to, I believe it's coming to GIC April 6th. I'll have to check my timing on that one, but I believe that's the timing. To talk about that particular investment and how can that be leveraged to improve the services and the health status of those who live in at is how can we expand beyond that to develop a truly comprehensive municipal poverty reduction strategy. So once we get this piece, which is a very specific investment, how can we look across the broad range of city services to have a comprehensive strategy that addresses poverty? Workplace culture. So this is going to continue to be a priority to us to continue to promote a positive, engaged, and high-performing workplace, particularly with the pace of change and the number of things that are going on. It's not an easy environment for all of our professionals that are out there. They know the budget constraints. They know that there's change coming. And so this piece is really important to us in terms of creating and improving our workplace culture to support our staff so that they can do the very best work they can to serve our community. That's the last slide. So those, you'll see we've gone from 7 or 8 down to 3 for this year. Very purposeful to be strategic and focused on where we think we have the greatest need in the community and where we think we can have the most bang for our buck. As I said before, we know those looming OPHS are out there, the new ones, and they will definitely have some impact for us, and we'll come back and talk to you about them as we receive them and understand them and what impact they may have. But that's the element of a good annual plan, is you set out the best things that you know need focus, and then you adapt as that information becomes available. Mr. Mayor.
Great. Thank you very much for the great presentation. I've got a couple of questions. Councillor Green and then Councillor Partridge. Councillor Green.
Yes, in looking at the conversation around the LHINs and the information sharing, I know there's certainly restrictions around disaggregated data, personal information. Has there been any conversation around opening up those data sets to other academics, researchers, the public, to be able to do broader analysis of the work that's being done in the city?
Through you, Mr. Mayor. So there's sort of two different elements. There's what we're doing with open data around the city. So absolutely, along with other departments, we're at the table talking about what data sets we have, how can we open those up, bring them to the table, because there is a lot of confidentiality and privacy issues related to our data. We have a shorter list than perhaps some other departments, but we're definitely working on that piece. We haven't brought that piece into the conversation with other partners. Right now we're working on our piece around that, but leaving that piece for a broader discussion that I know is going on between the city and around the Hale table about data and how do we use data and support open data across the whole community. So that's being led out of the city manager's office in terms of that broader scope piece.
Excellent. Thank you.
Thank you very much. Councillor Partridge.
Yes, thank you, Mr. Mayor. Elizabeth, I'm not sure which priority this would fit in, but I'm going to suggest health system integration. You had mentioned, I think, in your presentation about vaccines, and I believe you gave an example. But I'm just wondering, around the delivery of vaccines and this in-school program, how many schools is that still running in, or is it?
So school-based vaccinations are a provincial program. They're not a local program. So they're running in every school in this community and every school around the province. And of course, it depends on what age range is targeted. But most of these are targeted at the grade 7 level.
Right.
And so it'll be middle schools, elementary schools, those schools in which that's carried out.
Thank you for that. So it's not carried out by public health within each municipality, even though public health is provincial. It is delivered by a separate provincial?
No, it is delivered by public health.
Right.
So it is a provincial strategy. I'm just saying it's done the same way in every community in terms of every public health department does this across the province.
Okay, so
and it's
specific to
mandate.
ours, specific to your public health in Hamilton. Are you delivering vaccines in every school on a regular basis, or is it strictly to do with a particular grade across those schools?
So good question. So there's a particular set of vaccines that are delivered within schools. Those are hepatitis B, HPV, and meningococcal vaccine. And so those ones are delivered because that's where those adolescents, they tend not to get vaccinated terribly well elsewhere, and it's a great place to capture them just before the period at which those diseases tend to emerge in those age groups. You capture them just before and immunize them there. So it is specifically those vaccines. It's not the general immunizations around diphtheria, tetanus, all those. Those are usually initiated much younger and continued on. That said, we do offer community clinics for kids to do catch-up, and we would offer any publicly funded vaccine to do catch-up through those clinics.
And would that, through Mr. Mayor, would that be through the public school system or the school system period, regardless of which?
So the
For
three
the
vaccines
you were just talking about.
So the hepatitis B, the
Right.
HPV, and the meningeal is done in every school, regardless of whether it's separate or
Right, and that's what you
public
covered
and
off
private.
first. But then you mentioned about the measles and the other vaccines.
and they're not delivered in the schools. They're delivered in community-based clinics that we run.
Right.
And so they tend to be delivered in the same places, our dental clinics, sexual health clinics, those sorts of settings.
Okay.
And then because there's usually not enough kids in a given school at a given time in terms of a catch-up clinic. And so we invite them to come to our community clinics, and they can come from any school at any time.
Okay,
in terms
and
of
thank
doing
you. So,
that.
Mr. Mayor, where I'm going with this, because we are talking about priorities, I'm just with the recent article that was done on the state of the vaccines throughout our schools and the vulnerabilities that we have in different schools. Some are higher rates of being vaccinated than others. And so that potential risk to that broader group, which is part of what you're talking about, how do you reconcile that, and how do you correlate public health services to what was uncovered in that story, if you will?
So I'm going to turn to Jessica to add some more on this one, but I'll just start off in saying, so there's the direct vaccine delivery, and then the other thing we have responsible for is collecting immunization data on every child in the school, and of course we're the source of the information that article came from, and we go through the immunization records. Now, this is part of what we were talking about in our November meeting,
Right.
about the challenges we've had with getting back in, because we used to just do this in 2 years. And now they're 2 grades, and now they're expecting us to do it throughout all of the grades. But that is the role, is to look at how good is the coverage, remind people of their vaccination obligations, and if necessary, to suspend them from school if they're not staying up to date or have a valid exemption on file. So I'll just turn to Jess to see what more she'd like to add.
Yeah, so through the chair, maybe I'll just back up a little bit before I focus in on the school portion and just remind everyone about immunizations across the lifespan. So a lot of the immunizations that are occurring are actually happening before kids start school. So when Elizabeth mentioned some of those things like tetanus, diphtheria, measles, mumps, and rubella, we're getting those vaccines at ages before kids are in school. Then we have the vaccines that she talked about, the meningococcal, the human papillomavirus, and the hepatitis B. Those occur in grade 7. And then we also have a whole bunch of vaccines that we need as adults as well, and you'd likely see your family doctor to get those. So if we focus in on the school-based program, in grade 7 every year, we've offered those 3 vaccines to every student, regardless of what school they're going to. So any parent and child who wants to receive those vaccines will get those in their grade 7 year. Then you raise the issue about, well, all these other vaccines, there are some kids who were supposed to get them before they started school, but didn't get them. So now we're looking at catching up. And so we basically enforce and support the provincial government to enforce the Immunization of School Pupils Act. And this is what I spoke about back in November, where we go and we screen the records of students in specific grades in schools. And right now we're doing 7 and 17-year-old students because of the resource issues that we have, challenges in terms of getting through all of them. And then those students are identified. So we send a letter out and say, hey, you know what? You're not up to date on whatever this vaccine happens to be. We'd like you to get up to date by this point in time. And people are given the opportunity to bring those immunizations up to date. In terms of where they can go for those immunizations, they have several options. So one is they can see their family doctor, and that is by and large the most preferred option usually. They can also attend public health clinics where we catch those students up. They could also choose to go to walk-in clinics, and very soon many of these vaccines will be available through pharmacies as well. That's something that the Ministry of Health and Long-Term Care announced recently. So there is a broad range of options for people to get up to date on those. If they choose not to get up to date, they could either face suspension or they may choose to sign a statement of conscience if they don't wish to receive that particular vaccine.
So, yes, and so thank you for that. But I guess my concern is that there is a high number, a high percentage of identified in schools of youth that are not vaccinated, or whether they've chosen not to through their families. But I'm concerned about how many don't have family doctors. And so if we're going to do catch-up, but we're not going to offer that catch-up program of vaccinations through the school, and instead direct them to clinics and their family doctor, who they may or may not have, because there's a lot of students, families in general, that just don't have a family doctor, particularly in certain areas of our city. And so how are we addressing that? And I guess where I'm trying to see is, does it fit into any of our priority areas? If we're putting the onus on these people to try and search out where those vaccines are, it just seems a little backwards to me.
So through the chair, so you're certainly raising a good point. However, the one thing that I would point out is, after we conduct the review of records, in fact, most of those children are actually up to date on their immunizations. They have not provided proof of that to public health. And so what that means is the parent or guardian needs to submit their yellow card to us. So in fact, when we start off at the process, there's a large number of students who will not be up to date. And then by the time we get to suspension day, in fact, most of them are up to date, and in large part because they just submitted the records to us. There's a smaller number of students that do require getting their immunization. And, you know, right now, there are a lot of people in Hamilton. We are actually quite fortunate in Hamilton. Not everybody, but many people do have family doctors. There's also the option of walk-in clinics, and we do have the public health clinics, and we've done a good job, I think, of accommodating people to get them vaccinated before suspension date, so that we are not, and we don't keep students out of school if it's just because they haven't been able to make it to us in time. We let them back into school and get them up to date as soon as possible.
All right, and thank you, Mr. Mayor. And again, I guess, you know, we're putting the onus on the family. Many who don't speak English and may not be familiar with the way the processes work in Canada and in our local community. But I guess the other thing I just want to point out is the article was written based on facts and information that were provided by Public Health, which came from Dr. Richardson. So, you know, the articles were very clear that there's a large number, a percentage, that are not up to date. And so now I'm hearing, and this is very confusing, and if it's, you know, confusing for us, I can imagine how confusing it must be for people out there who are rightly worried about, you know, the measles and outbreaks of different diseases because of people not being immunized, when in fact what I'm hearing from you is most of them are or will be by the time that date is reached. So, you know, there's really, the information is not lining up here at all. So I just wanted to point that out. And if it needs to be a priority, I think, you know, I'd like to hear, first of all, is it going to be one of your priorities or within the priorities of what you're doing? Through you, Mr. Mayor.
Dr. Richardson.
So through you, Mr. Mayor, I think what would be helpful is to bring back a report on immunization coverage, just to understand that and unpack that a little bit more fully. I mean, the Spectator has done that, and, you know, quite frankly, they did a very good job of raising some of the significant issues around vaccination, but it's not always about do people have the ability to access immunization. Sometimes it's about choice around immunization. Sometimes it's about access. Sometimes it's about data not up to date. There's different pieces of it. So I might suggest that we bring back a report that goes over that data ourselves, that we can discuss with you and understand a little bit further. I think in terms of where would be the best place and how would we can people best access vaccination? I'm not sure that's through us. Just as I said earlier around the flu vaccine, I'm not sure we're the best place to do that. And certainly over the years, and the 22 years I've been doing this, we've looked at the issue of how do we increase vaccination rates amongst the vulnerable. And we've talked with some of the schools with the highest rates of non-immunization for the kinds of reasons you mentioned around newcomers, don't understand the system. And we're often told, you know what, that's their very last priority. That they're struggling with finding a home, money, food, and so that's, or not the very last, but that's a low one on their list. And that trade-off, like even if we're there in the schools, we're actually just increasing the pressure and taxing the schools who are trying to respond to these kids. And often they're just not ready to take up that particular piece of information at that time. So it's not a good use of resources to have them there. They're not well utilized if we were to put school staff into the schools. So I think that's why Julie's doing the work around the immigrant and refugee piece, is like, where can those services best be organized? We stepped in and did that when we had a very tightly clustered population where we could reach them and go through the complexities. But once they're out in the community, really the primary care services are the ones to best do that. And we advise them on how to interpret the records. So I think in terms of moving forward, let's start with understanding what the issue is and where there may be an issue. And we're absolutely happy to do that. The vaccine piece as a priority isn't on there because it's day-to-day business right now. And so that doesn't mean we don't have things that we should do and talk about. And so I would keep it at that level, whereas these tend to be on the things that really need to change and where there's a lot of dynamism in those. So why don't we start with that piece and then come back and we can talk about where we should take it further from there.
Thank you, Doctor. Councillor Partridge.
Well, and just, my last comment is, as long as someone's taking responsibility for it, especially when, we're in a city where we do have a lot of vulnerable residents, whether they're newcomers or just long-term residents and in their senior years. I just want to make sure that somebody is going to take responsibility for it. And, I'm not so sure that staff need to be given yet another project on their plate to bring a report back, but I'll leave that up to you if that's something that you feel would be helpful for you to explain to us. But I'm not hearing that it's a responsibility that's being taken, not necessarily by public health, but just in general terms. Who's looking after our people? Who's looking after our most vulnerable residents? But thank you, Mr. Mayor. Those are my comments. Thank you.
Okay, thank you. And we'll leave it in your hands, Doctor, to bring back a more comprehensive a report on strategic direction, gaps, and everything else that goes with that. Yep. Councillor Jackson.
Thanks, Mr. Mayor. Thank you, Dr. Liz, for your presentation on the work plan and priorities. My line of questioning, dovetailing on the prudent line of questioning and thoughts from Councillor Partridge, and it's on the OBL, Liz, and I know that the OBL is item 8.1, Mr. Mayor, but since it's been touched upon, the immunization, the vaccine, if you would allow me, I think it's germane to the excellent line of questioning that Councillor Partridge started on. Why, on page 5 of 6 of your OBL, Liz, it talks about Board of Health sending a letter from last November that Dr. Hopkins referenced, and I'm just curious, unless it's totally something different, it still says a due date required, and yet we've been talking about this for a few months. And has this letter been sent? Or I guess it hasn't been sent because it's still on the OBL. So can you just help me understand, because I'm a little bit confused and there's a disconnect for me right now, and I'm trying to save you from writing a whole big new report if this letter under the OBL might just do the trick. Mr. Mayor, through you, please.
Doctor?
Through you, Mr. Mayor. So this was the piece that was follow-up to the discussion in November around the vaccine program and this need to expand to review of all grades, whereas before we'd been focusing on 2 grades. And so this letter was to the province to advocate. This letter was sent. It should be reading completed in terms of this one, different. Lorraine. I believe it's gone through both levels in terms of coming through. So this one's gone out as of now.
So we can officially put down completed then, please?
Mm-hmm.
All right.
That's my understanding.
Well, that's a change. Okay. Sorry, Dr. Liz, didn't mean to interrupt you. Okay.
And Lorraine says that we'll do that on the discussion of the OBL. One thing if you don't mind, if I just come back to Councillor Partridge's point earlier, I think where you're coming at really relates more to our health services integration piece around our most vulnerable. And so the vision we've been talking about is how do we, for those that are most vulnerable, work with them to deliver services in the way that they need. And that doesn't matter whether it's social housing, OW, childcare, education, primary care, hospital-based care, or care that we provide. That's really fitting really well within the ACO initiative and those other pieces like Dundas Family Health Team and whatnot, to look at how can we better wrap around individuals in terms of providing them with the services that they need. So I think that's where we're going to find, rather than a vaccine-specific one, but really it's about how are we offering services to people in the way that they can consume them, in the way they can understand them, they know their needs, and move forward on it.
Thank you. Councillor Jackson, back to you.
Yep.
So can I assume that the completed and removed on item 8.1 will be updated then, based on what you just told us?
So Lorraine was just
Okay.
saying that she does have further,
Okay.
we'll go through that one and update it.
Further adjustments? Okay. Councillor Jackson.
Thanks so much, Mr. Mayor. So Dr. Liz, so have we received adequate financial resources? Did I miss that earlier in your presentation based on the letter that was sent and completed now? Mr. Mayor, through you.
Through you, Mr. Mayor, there's been no response from the ministry at this point to this particular letter. We do know that the ministry has said that they have had letters from more than just ourselves, and that in general, their perspective is that they've given us one-time funding to help us make the transition to the expectations, but that their expectation, as I said earlier, is that we figure out a way to do things within existing resources. Now, they'll need to respond to the specifics, and as the OPHS piece comes out, look at would they be willing to provide further investments in certain areas. So we await that specific response, but we've had similar responses in the past, and that's what they tend to look like.
Okay, so thank you for that update, Dr. Richardson. So then, with the completed letter, waiting for the ministry's response on funding, additional funding, over and above that, then you may still need to formally respond to Councillor Partridge's direction, Mr. Mayor, just to clarify and to sum up, so that I'm clear, please.
So, through you, Mr. Mayor. So this was not particularly, this was around doing the role that they expect of us. So when we get back to that piece about what role do we play?
Correct.
Our role has been immunization record review for students,
Right.
delivering immunizations to grade 7s, offering some clinics for those who need to catch up, and addressing the broader issue of vaccines and the importance of vaccines. Our role is not to do all of the immunization of people within our community. As Jessica outlined earlier, if you look at it over the life course, that's by and large carried out through primary care. So when we asked them for additional funds related to this, it was for our role as the ministry has asked us to do.
I understand that, fair enough.
So in terms of Councillor Partridge's piece, this isn't going to address that issue.
Okay.
And that's why with Councillor Partridge raising the thing about how do we ensure people who are vulnerable in our community are able to access immunization. This is really more about how does the community look at how its services are organized so that people who are in that circumstance can easily and effectively gain access to those services. And that's the work that's underway. Joanne's doing work in terms of community hubs. We're doing work with our health systems partners to look at how can we bring everybody together and rationalize those services to address those. And the people who are vulnerable are, our first priority around that piece.
So in my layman's language in terms, what you just said, and just tell me if I've interpreted correctly, instead of just somebody knocking on your door to be immunized, they may have a variety of areas across the system that they can be immunized. Mr. Mayor, through you to Dr. Liz.
That's right. So under the system, the way it is now, they can knock on our door, their family doctor's door, the walk-in clinic's door. They can walk on the pharmacist's door. They knock on the pharmacist's door. They can knock on a whole number of different doors in order to get that immunization. So there's lots of different venues. The question then is for those who are the most vulnerable, who are thinking about things like housing, food, income. Those are the things that they're dealing with every day. They're not thinking about, are my immunizations up to date, because they don't even have somewhere to be warm tonight or food to put in their kitties' bellies. And so then how can we wrap around those groups and give them the services they need so that they can be moving through those needs and thinking about immunization along the way as we go.
So what I heard earlier, though, is that that you're still going to do a report
We'll
on
still bring
that
you back
kind of
that.
broader piece and
Yeah.
ensure that we get coverage. Okay. That's great. Councillor Marula.
Thank you, Mr. Mayor. Doctor, what's really concerning me is this conspiracy theory, or the theories out there regarding vaccination. And on social media, it seems to really be gaining a great deal of momentum.
Yeah.
And I'm wondering, as a direct result, I'm sure there are a lot of parents that are choosing not to vaccinate as a result. And I'm wondering, how do we combat this misinformation that exists? And can we put together a campaign accordingly in conjunction with the province to ensure that people aren't acting as irresponsibly as I tend to believe they are right now in choosing not to vaccinate their children? So through you, Mr. Mayor, to the doctor, any suggestions?
So I'm going to turn to Jessica in just one second, but in the 22 years I've been here, and I was responsible for this portfolio when I was an associate medical officer of health and looking at it, the number of people who actually choose not to vaccinate for reasons of conscience is what we call it, because they don't think immunizations work or whatever it may be, that number is very small. Okay. It's about 2%, and it's been stable for my 22-year career. And in this area anyway, it doesn't tend to go up and down, and there's times at which we become more aware of it than others, and certainly the internet's allowed us greater access to those arguments and those sorts of things, but in reality the number of parents who choose not to provide immunization, which is the most effective way to protect themselves against those diseases, is actually very small and stays stable. So I'm going to turn to Jess in terms of, even though that's the case, what do we do?
Through the chair, so this is, I think this is a great point for us to talk about, because we hear so much more about vaccine hesitancy nowadays because of things like social media. And the vaccine hesitant group has become very vocal in this area. So I think first off, vaccines are safe and they protect us against diseases. The scientific evidence is very clear on that. And as Elizabeth said, a very small number of people choose not to receive vaccinations. As part of Immunization 2020, which is the Ministry of Health and Long-Term Care's longer-term plan to support vaccines and immunization in Ontario, there is a segment of that which is specifically devoted to addressing issues of vaccine hesitancy and how we work with people in the community to better understand immunizations, that they do work and that they are safe. Additionally, at a local level, we have been working with other health units to develop a, if you've ever seen whiteboard campaigns, like it's a YouTube video with the person drawing on the whiteboard. So there's one which we are hoping to be able to release soon, which is specifically addresses vaccine hesitancy. And so, it would be wonderful if the Board of Health would support us when that is ready in getting the word out so that we can continue to promote immunizations here in Hamilton.
Okay, excellent. So that's refreshing to know. And at the appropriate time, I'll move that motion because I think that's a great idea. On another front, along the same lines, the 2% number is actually, I feel much better hearing that. But there are some high-profile people now that are speaking quite vocally on this particular issue, particularly stateside. Mm-hmm. And I'm just wondering if there is a thought of collectively, provincially and nationally, putting together a campaign just to emphasize the facts as opposed to some of the fiction that's being communicated. And if we need to formally bring forward a motion to start that ball rolling, I think that is something I would want to pursue as well. So I'll take this offline with you to word it properly, so that we can incorporate all the necessary wording. But I think it's important enough because of what probably is coming down the road, particularly stateside, and then the misinformation I see quite openly on social media, and the fact that people are starting to think twice rather than just reject it is really my concern. So if we can get ahead of this curve, it would be greatly appreciated. And on that front, I'll take it offline with the doctor, and we'll go from there.
Perfect. Okay, that's great. Thank you very much. I have no further questions other than Councillor Whitehead.
Thank you, Mr. Mayor. Recently, I went for a medical procedure, and before I entered into that arrangement, they talked about all the risk, and it was a bit scary at first, and then they give you the number. So I think it's about putting perspective, which one is the greater good in the context of vaccinations. But let's be clear, it's still out there that 1 in whatever million or whatever could be impacted by the vaccination. I think putting that statistical information into context. I mean, you have in many cases, a greater chance of getting hit by a Russian satellite than having any negative response to a vaccination. So I'm trying to get this put in layman's terms because I think the problem and the challenge is they don't have a great context of what that really means. And I hope that in the education that we can provide that analogy of, how low the risks are. And I don't think that's really clear amongst some. And I want to make it clear, and I agree with you, that it is a very small percentage. We'd like to get that percentage lower if possible. But even then, it's my understanding, and you can clarify this, because I saw a report, I don't know if it's the Toronto Public Health or maybe it was the federal, but talked about that number's always been built into the overall analysis of vaccinations, and in fact, it is a very low risk to the greater population based on that data. Can you just provide some clarity on that?
Jessica, do you want to address that one?
Yeah, so through the chair, so I guess a couple of things to address. So one is you raised a really good point around the statistics, certainly. So we have tried to, and Dr. Julie Emily did a lot of this work, make really clear with all of our consent forms what the risks actually are in terms that people can understand. And these were all tested with the average person in the community. So we feel pretty confident that particularly for the vaccines that we deliver in schools, that information is as clear as possible because we do want people to know the risks and the benefits. The other issue, I'm sorry, what was the other issue you raised?
Well, the fact that through the analysis of the vaccinations, that built into that whole strategy is there's going to be a small percentage of people for whatever reason, will not get vaccinated. And that is actually built into the risk management. And my understanding is that as long as that number stays there, it's acceptable within the risk.
Yeah, so we always know that there's going to be a certain number of people who can't be vaccinated, sometimes for medical reasons is one. We also know that there is no vaccine that is 100% effective. Our vaccines are very good, but they're not 100% effective. So yes, when we're looking at modeling of what the coverage of the population is going to be, those kinds of factors do have to be taken into account when the calculations are being done. And certainly across Hamilton, overall, our vaccine coverage is good, and in some cases better than it is in other places in the province. And what we're working to do is to try and keep those numbers as high as possible and prevent pockets of areas where there are people that are under-immunized. So, for example, particular schools, because then the risk will be higher in those areas.
I really appreciate the clarity, because I think it's important to understand that that modeling, it takes in consideration the low amount of population that, for what good reasons or bad, don't take vaccinations. We just don't want to see that number grow, and we don't want to see it clustered, I think is what I'm hearing. You certainly wouldn't want to see one cluster in a particular school zone where there's a high inactivity of vaccination, and those are what you're really targeting. But on the overall population in the city of Hamilton, our numbers are certainly well within the realm of safety. Is that the best way to put it?
So through the chair, certainly at a protection level, we are doing well. We can always do better, and we'll continue to work to doing better.
Appreciate it. Thank you.
Okay, thank you. And I do know that Russian satellites are flying lower and lower all the time because they're spying more and more. So maybe the odds of that are going up. I'm not sure. Could I have a motion to receive the good doctor's report or presentation? Moved by Connolly, seconded by Pearson. All in favor? Carried. On the report itself, item 7.1. If there are no further comments or questions, a motion to receive the report as well. Moved by Councillor Vanderbeek, seconded by Councillor Johnson. All in favor? Carried. Thank you. And we have the outstanding business list and associate changes. And Laurie, you were going to make an additional change to include the vaccine program update.
Yes, it's on the list of items that will be
Yeah, you know what?
marked as
Interesting
completed.
enough, I just saw that at the back end of that. So, on the outstanding business list, Councillor Partridge, Councillor.
Yes, thank you, Mr. Mayor. I just wanted to thank our clerk for her excellent work. We had our agenda review meeting for this meeting, and one of the things that was noted is the absence of an outstanding business list for the Board of Health. Now, there has been one in existence, but I thought it would be very helpful if it was attached to our Board of Health agenda. and that at each meeting, we did have it, and any changes that were going to be made to it, which came out of our discussion, could happen through the clerk at that time. This is regular practice for what we do at our other committees. And I know certainly with Planning Committee, and Councillor Pearson and I are on that with Councillor Farr and Councillor Matthew Green Johnson and others. And, it's very helpful to have that outstanding business list so that we're not kind of thinking back, didn't we discuss this 2 years ago? Didn't we do that? And I think as well for staff, it's helpful because it's there, it's front and center, it's in black and white, or orange in this case, or yellow. But then we're able to see what it is that staff are working on and whether or not the correct timing has been attached. Because I think that's the other issue. If our expectation is for staff to come back to us in a timely manner, then they need to have that in writing and understand what the dates are that are attached to that. So I just want to thank Madam Clerk, and I also want to thank Helen, for your work in being part of that meeting, and everyone for pulling this together. Thank you.
Great, thank you very much. So on the amendments on the outstanding business list, could I have a motion to approve those? Councillor Pearson, Councillor Green, all in favor? To receive the entirety of the outstanding business list then as amended, moved by Councillor Partridge, seconded by Councillor Connolly, all in favor? Carried. Councillor Partridge, I understand you have a motion.
Yes, I do. Thank you, Mr. Mayor. I will be looking for a seconder if someone would. Councillor Farr, thank you very much. So moved by myself, seconded by Councillor Jason Farr, for a review of the City of Hamilton Public Health Services school program. A, that public health staff complete a school program review with the goal to providing recommendations for programming in alignment with both school board needs at the elementary and secondary school levels, Ontario public health standards, and City of Hamilton context and local needs. And B, that public health staff consult with all publicly funded elementary and secondary school boards on a more integrated approach that includes mental health wellness. And C, that the review of the Public Health Services School program be added to the Board of Health Outstanding Business List. And D, that staff report back with a review of the City of Hamilton Public Health Services School program to the Board of Health by the third quarter 2017. And if I may speak to it briefly.
Yes, ma'am.
Yeah, so, this review has been on the horizon, if you will, and certainly I think public health have started to work on this. This motion really comes out of a couple of conversations that I have had with some of our local schools, with the trustees. We are looking to do some sort of a program, a Waterdown High School, that ties in more of the mental health issues, which there's no question in all wards right across the city, the province, the country, the world, if you want to. Mental health issues are key. They're really a priority that we need to address. But particularly within the school system, we have the Sir John A. Macdonald has a wellness hub that is in operation. I've toured the facility. I've met with the staff there. We've met with school board director as well as some staff to talk about just how can we look at doing something similar, ideally as a pilot within the Waterdown area. But in order to make sure that this is on our outstanding business list and that staff are aware of what the expectations are, because that's the other key thing is, what are the expectations? I wanted to put it into a formal motion, and it's supported by staff. I know it's certainly supported by the school board, and I want to thank again Madam Clerk for her work. And Ellen for helping pull the wording together that's appropriate for this particular motion. So I hope everyone will consider supporting it. Thank you, Mr. Mayor.
Okay, thank you. So moved by yourself, second by Councillor Farr. Any other questions? If not, all in favor? Carried. Any opposed? Hearing none. Thank you very much, Councillor Partridge. We have the closed, or item 11.1, correspondence that would need to be referred to our staff. Moved by Councillor Whitehead, seconded by Councillor Green. All in favor? Carried. That's 11.1. And we have the closed session minutes. And unless there is anything to discuss, we could move those closed session minutes and direct that they remain confidential. Moved by Whitehead, seconded by Johnson. All in favor? Carried. Any other motions? If not, we have a motion to adjourn. Moved by Councillor Pearson, seconded by Councillor Vanderbeek. Thank you all for being here. All in favor? Thank you. Have a good afternoon.
I've been sick for a week, so. Oh, God. Yes. Yeah. Yeah, I know, because this week's my day.
Happy to start
Yep.
What did I do, Margaret and Mary? Nothing. They came home and we've been at Councilor Jackson.